All right, awesome. So let's dive into some of those issues. And I really like that you meet people on their own turf and show
Right.
them where you have common ground, and then you can show them where you disagree with them, and then you can lead them into the liberty movement. I think that's really great.
Hmm.
So a huge issue right now with coronavirus and with the Democratic nominee, the Democratic candidates who are bringing up issues about like Medicare for all, things like that.
Right.
What is your and Joe Jorgensen's plans for reforming healthcare? How do we make it affordable? And more than just making it affordable, how do we make sure that everybody can access it, even people who don't have any money, who are, going to fall through the cracks?
Right.
And after you talk about that, I'd like to ask specifically about the Veterans Administration.
Absolutely. Well, so there's really two main things there. One is how government can respond in terms of like a pandemic, and then just the greater healthcare question. They're all kind of fed into the same thing because it is a healthcare question. As my running mate Joe says very often, COVID-19 has exposed all of the problems in our healthcare system. Not just the cost overruns, but the problems with actually getting access and with the red tape that gets in the way of medical professionals being able to actually do their job and test and treat and contain patients during a pandemic so that it actually can be contained and not, be this thing that we have to deal with for, endless months and years at a time. Keep in mind the first 2 months that the COVID-19 pandemic was here, the CDC, the Centers for Disease Control, the organization that Republicans and Democrats created at the federal level to protect us against these exact types of diseases and outbreaks, banned medical professionals from testing patients for COVID-19 for the first nearly 2 months it was here, something like 6 to 8 weeks that it was here. If you went into a doctor's office and said you were concerned that you had COVID-19 and just got back from Hubei province in China, and that you were worried you had this disease, it was illegal for the doctors to test you for it. Thankfully, some
Right.
doctors broke the law and still tested for it. And when they got those results back, apparently, it took the government 2 months to finally admit that they couldn't make their own test kits. And yet these doctors were making their own test kits in-house. They worked perfectly fine, proving yet again that government sucks at everything it tries to do. And they made these test kits. They tested patients. Some of them came back positive. They took those results to the CDC, and the CDC's initial response to hearing that there were positive results, that COVID-19 was here. Their initial response was to tell those doctors to destroy those test results and tell no one, and not even tell those patients. Again, this is a virus that we're being told, left to its own devices, can double in its spread in the number of people it's infecting every 24 hours. Okay. I mean, this is something that could infect all of us in a matter of a couple months if it were left to its own devices. And they told the medical professionals, do not test for it.
Right.
That's why we are where we are. That's why the US is worse off than any other developed country when it comes to this pandemic. All the stuff we're hearing, oh, government didn't do enough. No, government did plenty, and it was terrible. If government had simply let medical professionals do their job, because the government doesn't test anyone, it doesn't treat anyone, it doesn't cure anyone, it doesn't create anything. It tells people what to do and what not to do. And in this case, it told medical professionals, do not do your job in the face of the worst epidemic in, at least in the modern era, possibly in human history. And so now we have the problems that we have now. And the states reacted, Republicans and Democrats, by telling us all, or most of us, that we were non-essential and to stay home until further notice. And the federal government said, here's $1,200 of your own money. You're going to have to pay that back with interest thanks to the Fed. And we're also going to give trillions of dollars in bailouts to our multi-billionaire political cronies that sponsor us to be in office. And so we'll make sure that their bottom line isn't affected even remotely. You can have your finances ruined. We really don't care. Again, you're non-essential. And oh, by the way, if you don't listen to us and do what we say, we'll put you in jail and make sure you get COVID-19. So in other words, if you don't listen to everything we say, even though we created this problem, if you don't listen to us and comply with our every order, we will make sure you get infected with the virus that we allowed to spiral out of control by not allowing your doctors to test you back when it could have potentially be contained. And these are the people now saying that they should be in charge of who does or does not get health care.
Right.
You mentioned the VA before I did.
Yeah.
Anyone who wants to see what it looks like when the U.S. federal government is in charge of healthcare, I admonish you to look at the Veterans Administration. There's a reason they're calling it Medicare for all, because Medicare has largely positive outcomes, roughly the same as people that are in just the general private healthcare market. Medicare pays 80% of the cost, and the patients pay 20%, and it's only for a select group of people. In order for it to be what they are talking about, where it covers everyone and covers 100% of what the cost of healthcare, it ain't going to be Medicare for all. And it ain't going to be Medicare for the people that are on Medicare. It's going to be something between Medicaid for all and the VA for all. And anyone who has been on Medicaid or the VA, especially the VA, can tell you that is not a good thing. And especially when you consider that it will effectively destroy the private healthcare market, which will mean it will have to become a nationalized system. So if they were branding it more honestly, it would be VA for all. And there's a reason they're not branding it that way, because the current customers of the VA can tell you exactly what it is. Millions of Americans signed an oath, took an oath to protect and defend the Constitution against all enemies, foreign and domestic. They were sent overseas to fight and kill and potentially die on behalf of well-heeled political cronies like military contractors and surveillance contractors and others, and also on behalf of foreign dictators. And then when they were brought home, as I'm often told by veterans around this country, they were given a second chance to die for their country by having to use the VA. And so that is the system we have right now. Our plan for the VA, first of all, because this is the easiest one to describe, we end the VA. We simply give veterans the money that they need to get private health care, which will give them far better outcomes and save taxpayers billions of dollars, because yet again proving that government sucks at everything it tries to do. The VA, which is the worst form of healthcare in this country, costs more money per patient than simply giving the money to the veterans directly and letting them get private healthcare and have the good outcomes that we typically expect from the private healthcare market. So that's our solution to the VA. Very simple one. It's so simple that Republicans and Democrats will fight it tooth and nail, because it will prove that they have no business in the healthcare business. Going back to healthcare. With the pandemic, the way we would deal with the pandemic is that we would allow medical professionals to deal with the pandemic, and we would get the government red tape out of the way that makes it hard for them to do so. Even now, even in the midst of everything now, we still have test shortages right now. It's been months. There should be no test shortage. Do you know why there's a test shortage? There are companies in the US right now making at-home test kits and shipping them to other countries. It's illegal for them to sell them here. There are test kits that you could pay like 10, 15, 20 bucks, including shipping. And a few days later, you would have a test kit at your home so that you don't have to go outside. You know, the people that think they might have COVID-19 right now have to get in their cars and go interact with the public before they can find out if they have COVID-19, right? Instead, they could have it shipped to them. And it's a very simple, like a blood prick test that they can do themselves at home. And it would tell them not days or weeks later, but I think a half hour or so later, give or take, whether or not they have it. And they're very accurate. Do you know why it's illegal here? Because they don't automatically report to the government. The federal government believes that if they can't know if you have COVID-19, you shouldn't be able to know. That's just one of a myriad of examples of how the government makes it harder for our medical professionals that are on the ground fighting this thing to be able to do their job. We could spend an entire episode just listing out all the restrictions and red tape and burdens and regulations that are in place that make it exceedingly difficult for them to do their job, which is to try to protect us from this pandemic, especially the elderly and the immunocompromised and the sick and so forth, the most likely to actually get sick, really sick from it and die or have permanent organ damage from it. It is because of government making it harder. As that relates to the problems we were having before the pandemic, the cost of healthcare and low access to affordable care, we look at the fact that, according to most studies, the cost, as much as 75 to 80% of the cost of healthcare is just the cost of compliance with red tape and burdens and regulations and taxes and mandates that come from Medicare, Medicaid, and government-mandated insurance. Keep in mind, I'm not talking about the cost of providing health care to people on Medicare and Medicaid and government insurance. I'm talking about the cost of complying with the regulations. And that shouldn't surprise you. If you go into a medical center or you go into a hospital, what do you see? You see one doctor, one or two nurses, and a dozen administrators, right? There's one person that just does the insurance. There's one person that just rings you up. There's one person that just gets your biometrics so they can put you in their system. There's one person that does this. There's one person that does that. There's one person that does this. This isn't because they're being, because they want to have that many people working for them. They're required to have something like 80% of their workforce just be people pushing paper to comply with various regulations and laws. This does nothing for public health. This does nothing for public safety. It is entirely bureaucracy that is built around compliance with absurd regulations and laws. The major medical companies like Kaiser Permanente and Cleveland Clinic and Athena Health and these large groups, they can afford it. You know who can't afford it? Your local doctor, your local hospital. So they either go out of business or they just go and work for one of these major medical providers. That was the whole point. Drive up the cost of doing business so that they shut down all of the small clinics and replace them with these big corporate behemoths who just so happen to be the one whose lobbyists wrote all these regulations. Funny how that works, right? But it also drove up the cost of healthcare. It also made it exceedingly difficult for you to be able to get affordable healthcare. And now the same organization who worked with those same cronies, the federal government, who made this our healthcare so unaffordable and made us so unprepared for a pandemic, is now saying they have fantastic news for you. They are prepared to completely take over healthcare.
Yeah.
So that is the problem. Our solution is get rid of that red tape, get rid of the burdens, get rid of the regulations. Don't get rid of the safety nets, but get rid of the burdens and regulations, because not only does the cost of healthcare go down for private consumers, the cost of Medicare goes down. If the cost of providing healthcare goes down, it goes down for people that are on government assistance as well. So it makes those systems more sustainable. It makes the cost of healthcare more sustainable. It gets government and its cronies out of it. It gets one more thing I have to talk about: patent protections for medications.
Yes, I was going to ask you about that.
Okay, the fastest growing part of healthcare right now, if you break down all the different costs related to healthcare and how fast they're growing, the one that is growing like it looks like it looks like a plant growing towards the sky, is pharmaceutical costs, and that is entirely related to exceedingly strict and exceedingly long-lasting patent protections from the government. If you're wondering why insulin costs a freaking fortune here, even though it's been around longer than you've been alive and costs pennies in most other countries, it is because of those patent protections. It is because the federal government says, this company who just so happened to sponsor us being in office, this company has the exclusive right to make this kind of epinephrine, which costs pennies to make, or this kind of insulin. You can make, and I wouldn't recommend it because we're not professionals, but there are actually like 3D printing schematics on how to make your own EpiPen, which would cost like a couple dollars to make. And again, I'm not recommending you do that because we are not medical professionals or people that are experts in this. But experts who could do this, they could be selling these things for $5, $10, $15, something like that. Instead, because of patent protections, you have a handful of companies that have the exclusive right to make it, and they work as a cartel with each other, not to compete with each other, and they jack up the price of these drugs 100 times, 1,000 times, sometimes tens of thousands of times more than they charge anywhere else. And then they make it illegal for you to go to other countries and get those drugs. Even though those drugs are legal here, they're legal there, and you have a legal prescription. The act of you going somewhere else and not being captive to the pricing that they have here and not being stuck in this captive market is against federal law. That's one thing I agree with Bernie Sanders on, is that you should be able to go to other countries and import drugs and bring them back. And it really breaks down after that. But that's one thing I agree with him on. And it's the entire purpose for it is to protect the patent protections of large, cynical corporations who don't care if you die because you can't afford insulin. Getting rid of those restrictions and barriers and burdens and getting the power and the wealth and the freedom out of the hands of the cronies and putting it back in your hands where it always belonged will allow prices to come back down to an equilibrium of what you can actually afford. And now healthcare can be affordable. Now the people that are on assistance, that can be a sustainable system. Now we can get the healthcare we need. And now, God forbid there's another pandemic like this or this one continuing, the medical professionals are actually empowered to be able to deal with it and get it contained.